Hi, my name is Brittany Robertson. Today I'll be discussing an optimal health system by mentioning examples of different strengths of health systems from a global perspective. You may be asking yourself, what is an optimal health system? It is an integrated health system that provides health services that are ethical, financially fair, and treat people humanely. An optimal health system will need staff, funds, um, information and research, supplies, advanced technology, um, transportation, transparent communication, guidance, and a sense of direction. When trying to understand and research what an optimal health system is, I came across this quote. Optimal health is a dynamic balance of physical, emotional, social, spiritual, and intellectual health. Therefore, lifestyle change can be facilitated through a combination of learning experiences that enhance awareness, increase motivation, and build skills. Most important, through the creation of opportunities that open access to environments that make positive health practices the easiest choice. And I wanted to mention this quote because I think that for an optimal health system, this is the vision of it, and this is what we would want to guide it, and this is the direction that we would want our optimal health system to follow. Now I'll discuss the strengths of the US health system, and these are things that I identified as strengths and think should be incorporated in an optimal health system. The US has a strong and developed infrastructure. They use advanced technology and have modern health facilities. Also, their workforce is well trained. They have a wide range of high quality medical specialists. Their medical schools are highly sought after. In the US, there's also robust and well-established research organizations. And when addressing the COVID-19 pandemic, they were able to make great achievements by expediting the research and testing for the COVID-19 vaccine to get it out to the public as fast as possible. And then they also were able to transition to telehealth. Now I will cover the strengths of the Latin American health system. Um, in that region, there are 18,000 hospitals. Brazil has more hospitals than the US. 42% of the top hospitals in that region are located in Colombia, and the best hospitals in that region are located in the larger cities across the region. Healthcare coverage is more affordable in comparison to receiving healthcare in the US, especially in Mexico, Colombia, and Panama. And then in Peru, 73% of Peruvians receive free healthcare services, and the government in Peru and Brazil, they are seeking ways to increase government provided healthcare, so the majority of their population can receive free healthcare coverage. And then I think it was important to know in Latin America, that they realized during the COVID pandemic that they need to increase their mental health services. And they also started using, well, not started using, but increased their telehealth services, just like just like the U.S. Started increasing their telehealth services and providing care through telehealth. Now I will discuss the strengths of the European health systems that I identified to be beneficial for establishing an optimal health system. What I noticed in Europe is that many countries have comprehensive primary health services, and this gives many Europeans access to primary care services. In Europe, they have set goals for their patients to receive urgent care referrals within 2 weeks, referrals for breast health within 2 weeks, and patients who are diagnosed with cancer to start receiving treatments within 31 days. There also were reports that 52% of patients who reported being sick were able to receive same-day appointments, and 69% of patients who needed care after hours were able to receive care easily or access care easily. And then in 2015, the UK implemented an integrated healthcare delivery model, and this incorporates 5 what they call vanguards. So they integrated primary care and acute care. Then they enhanced in-home health care, establish multi-specialized community healthcare providers. Then they integrated urgent care and emergency care services, and they also established acute care collaborations, hopefully to strengthen, with the intent to strengthen their healthcare system. And then when it comes to technology and innovations, I came across Ireland, and Ireland's government was under pressure by its citizens in the EU to improve its health system, and the government invested over $4.90 million in health information technology. Funds were also given to address web medicine, infection control, staffing, infant and maternal care, and also care treatments for addressing hepatitis C. And funds also went to other health resources. And then during the COVID-19 pandemic, what was something that was admirable was that Germany, they wanted to help their friends, they wanted to help the countries around them. So Germany was accepting sick patients from Italy, patients with COVID from Italy, Spain, and France to support their allies who were overwhelmed with COVID patients. I'd like to discuss the strengths of the healthcare systems in the Middle East and in Africa. I will admit that it was challenging to find strengths within these two regions because their healthcare systems are outdated and their populations are also plagued with many disparities. So there is a lot of work that needs to be done to improve those healthcare systems, but there were a few things that I thought were notable and should be recognized to be incorporated within an optimal health system. And one thing was recognized by the World Health Organization, that Jordan has a successful delivery system, and the rural court clinics in Jordan have established a system where the poor and rural populations, they are able to apply or be referred to public hospitals to receive healthcare, and the costs are covered by the government. And I found in Israel that they strive to provide world-class care to their people, and they try to provide this care so their people do not have to go to other countries to receive health care. What I noticed in Israel is that the healthcare system seeks to standardize their supplemental insurance, cover healthcare costs for the poor, cover the healthcare costs for the poor, establish a fund or increase funding for pharmaceuticals. And then another thing about Israel is that Israel had broke the world's record for vaccinations. It started with signing contracts with the U.S. pharmaceutical companies to receive COVID vaccines before the U.S. had even issued the emergency use authorization for the Pfizer vaccine. Israel had launched their COVID-19 vaccination campaign on December 20th, and by December 29th, they had about 150,000 Israelis vaccinated. So they were on it in trying to prevent the spread of COVID amongst their citizens. Now I'll discuss the strengths of Asia's healthcare systems. But I do want to mention that I noticed Asia was similar to the Middle East and Africa, whereas they need to update their healthcare system, improve health policies, increase access, and also increase funding to provide an adequate healthcare system for their people. But I do want to mention that I did find some good things, some positive things within a few of the countries, and these things could be incorporated into an optimal healthcare system. So what I found in India is that they have a national rural health mission which supports the maternal health needs of rural and poor families and children. And the mission provides funds for initiatives that address maternal health and children's health among rural and poor families in India. And it also incorporates local health traditions. I thought that was important, that they weren't people weren't losing their identity and their culture, and that their traditions were being respected when addressing their healthcare needs. And then also in India, through increased use of technology such as TV, the internet, and cell phones, they are able to revive the interest in the use of indigenous health and traditional health. So I thought those were positive things. We always want to respect someone's culture and incorporate that in healthcare treatment. So those would be things that I think an optimal healthcare system should incorporate. And then I also came across North Korea. North Korea's healthcare system, and it's heavily regulated, and this leads healthcare providers to provide high quality care with strong regulations on fee for service. Healthcare providers are not able to compete through pricing, and it encourages healthcare providers to provide high quality care, friendly service, and use advanced technologies when treating patients. And then what I noticed about Japan was that there's a great focus on prevention and diagnostics in Japan. Compared to other countries, Japan has the most CT scans, the the most CT scans, MRI units, and radiation therapy equipment that allows them to focus on preventative care compared to other countries. And then in Southeast Asia, Singapore and Vietnam were immediate in acting to prevent the spread of the COVID-19 virus. Singapore and Vietnam utilized apps that aided in tracing the virus, and they also created COVID-19 testing kits and antibody kits in the early months of the pandemic. So that initiative to protect their people paid off, but what led Singapore and Vietnam to be so proactive is that they had in 2003 overwhelming cases of SARS, different strains of SARS, and because of that experience in 2003, they were able to be proactive during the COVID-19 pandemic. In conclusion, I like to say that the strengths mentioned in this presentation would be able to provide affordable care with well-trained, high-quality staff. It would involve the utilization of advanced technology in research facilities, and it would ensure that it did not dismiss someone's culture and incorporate someone's culture and tradition into their healthcare needs. That would be my ideal vision for an optimal healthcare system. Thank you.